Matt Shu from Upright Health, and today I'm going to be talking with you a little bit more about why I feel so passionately about thinking about FAI not as a bony issue and more as a muscle issue. I actually have a list of about 389, not about, exactly 389 studies done to understand the bony abnormalities of FAI and to understand how different surgical procedures and different radiological measurements may affect people's outcomes when dealing with FAI. And the most striking thing when going through all these studies is that even right from the very beginning, right into starting from 1991, where there's a case of 6 cases in Germany where they start talking about FAI. Even from the very beginning, all these studies are done from the perspective of orthopedic surgery. Now, orthopedic surgery tends to be focused on the bones because the orthopedic surgeons are working on your bones. They are not focused on muscle activity. They're not focused on neuromuscular efficiency. They're not focused on learning how to train parts of your body to move correctly. So there is a very strong bias through all the studies that I've looked through in that they only look at bones as the possible cause of any sort of movement abnormality. So that's an important thing to notice because the assumption right from the very beginning is that if you can't do action X, it must be because of bony abnormality somewhere, Y. Okay? So if I can't do this, let's just think about my elbow joint. If I can't do this, then it must be because there's something wrong with the bones that make up my elbow joint. Okay, that is the assumption that's being made. So if I go like this, I stop here, I can't go any further, it must be because of the elbow joint. Okay, that is the assumption being made. Is that always going to be true? Probably not. The way a joint works in day-to-day life heavily depends on what the muscles around the joint are doing. So when you think about the hip joint, you have 20 some odd muscles all around the hip joint that wrap and help control it, right? They're basically going 360 degrees around that ball and socket joint, pulling at weird angles in all directions, and they all help move the ball in the socket properly. Now in an X-ray and an MRI, you are never going to see anything about what the muscles are doing. And I think, frankly, it'd be a waste of time to try to really get down to the nitty-gritty on which muscle is, a percentage weakness of another muscle or whether or not this is firing, that's not firing. There are easier ways to do it and that are just more practical and actually more cost-effective. Now, all these studies have been done for about 20, 30 years now. I just realized how much older I am than I thought. They've been done for decades now, and they are basically saying, here's FAI, it is a bony thing, it's a bony thing, it's a bony thing. If you find this in an X-ray, then you'll find that when you try a certain range of motion, you will not be able to do it. Right? So the idea is if you have FAI in an X-ray, in an MRI, you're going to find labral damage, and then in a physical examination, when you try to flex and rotate somebody's hip, you're going to find that it hurts them, and the reason it hurts is because the labrum is being hit by the femur, right? By the head of the femur. So that's the basic idea behind FAI, right? So you have the X-ray shows something, the MRI will show the labral tear, and then the physical examination will elicit pain, and we're saying that the pain is then from the labrum. Now, that sounds all well and good, but my whole thing with this is I work with people who have groin pain. I have people who have had the diagnosis of hip impingement, okay? I myself have jacked my hips up beyond belief because I've played ice hockey as a goalie for years, and it's one of the things that actually probably messed me up and then also gave me motivation to fix my own business Okay, so what I've found over the years is that the body can hurt for a lot of reasons, right? Your hips especially can get painful in many different ways that are completely unrelated to the labrum, right? I don't know if you believe me, but I think most reasonable athletes can tell you can strain a lot of things in there besides the labrum, and that things can get a little bit funky, and it doesn't have to be something that's inside the joint that hurts. So I was thinking about this when I stumbled across, in my very long list of studies, a study done by a Dr. Weir. I'm not sure how you pronounce it properly. It's W-E-I-R, and he's from the Netherlands. I assume he's a man. And they did this. He and his team actually did this study with 34 athletes who had groin pain, who had hip pain all up in here, right? And they decided to figure out whether there really truly is this relationship between the bony abnormality and pain in the groin and the lack of range of motion. Okay? So what they did was they took these 34 athletes and they said, let's do the x-rays, let's blind the radiologist so they don't know who has what symptom, they don't know who's who, let's blind the examiners who do the test to see what happens when we examine all these people with hip problems and see what we come up with, right? Ideally, in an ideal situation, the people who have FAI in the x-ray are going to have pain when they do that fun hip flex and internal rotation test. So what they did was they took these 34 people and they looked at both of their hips, the right side and the left side. So they had a total of 68 hips. 94% of those hips had radiological signs of FAI. So that means in the x-rays, 94% of those hips had signs of FAI. 94%. Okay, so then we go ahead and move on down, and when we look at the anterior hip impingement test, when they did this test, how many people or how many hips do you think had pain? Because we already have the FAI. We already see the FAI in the x-rays. So when they do this anterior hip impingement test, how many should have FAI? Or should have that pain? We're thinking 94% of these hips have FAI, right? Well, then when we go into the test, turns out that a mere 9 hips tested positive. So that means, and I'm quoting directly, there was no correlation between hip range of motion and the number of radiological signs. And here's the conclusion. The radiological signs of FAI are frequently observed in patients presenting with long-standing adductor groin pain, right? Adductor-related groin pain. So clinicians should be aware of this fact and the possible lack of correlation when assessing athletes with groin pain. So what does that mean? This study goes on a little bit, if you actually really want to read it, it's very long, but they start talking about how that there are other causes of pain in the groin, right? You can have causes of pain in the groin that are completely unrelated to your labrum, right? And I would submit very much related to the way the muscles around the joint are balanced and working or not working together. So this is like thinking about, for many people, this is like thinking about ancient Greek, right? So I want to try to simplify this with these two balls, okay? If we think about your hip, let's just simplify it. We're not even going to talk about x-rays. We'll say you can, your hip, whatever hip that, let's say your right hip, okay? If your right hip has a red ball, if the right hip, that ball on your hip socket joint, your hip joint, let's say the ball is red, we have a test that can tell, right? If it's red, then that means you have a problem that we need to fix with surgery. If it's yellow, then you don't have a problem and you should have no movement problems. Okay, so again, you have a red ball in your hip joint, that means you will have a lack of range of motion, you will have pain, and we need to operate. Always. Okay, you have a yellow ball, that means you're good to go, you have great range of motion, you have no pain. Bingo bango. Obviously you want the yellow ball. So that is the theory currently with FAI, right? You have a bony abnormality, it causes you pain, it causes you a restriction in range of motion, you need to operate. However, the reality is you can have this red ball and no loss of range of motion. You could also have this red ball. There's another study that I don't have up on my computer right now, but there's another study that says you could have a red ball, but you will have no pain. So what difference does it make if you have a red ball, right? The red ball and the yellow ball, while they look different color-wise, apparently have no bearing on whether or not you have pain in your hips. If that's the case, how can you justify the surgery? Now, some people may say, well, surgery seems to work sometimes, but there have also been many surgeries done in the past, like spinal fusions, arthroscopic knee surgeries that have been done for decades with some amount of justification, only to find out, we find out 10, 15, 20 years down the line that those surgeries were actually no better than placebo, even though these surgeries are $25, $50, $100,000 procedures. If you ask me, I'll take the sugar pill rather than the risk of infection and all the other things. So when you're thinking about FAI, it's very important to remember that all the studies that have been done so far have simply assumed that it is a bony issue. All the research is done from the perspective of it's a bony issue, and there's nothing you can do about it besides cut, sand it down, and send the person off. FAI symptoms, I do encourage you to take some time and do some reading and see exactly what's going on with the research. And also, I have a lot of videos on my YouTube channel under the playlist about FAI with different strategies, different ideas to help you overcome the issues. It is a long road. I will not say that it's super easy to break out of the hip discomfort that goes along with the diagnosis of FAI. However, usually there is some positive development within the first month or so. And if you do an FAI surgery, oftentimes you're in for an 8, 9, 10 month, 11 month, however many months recovery from that anyway. So you put some time in, no matter what path you choose, you're going to have to put in some work and some effort to really recovering the mobility of your hips. So hopefully this gives you some food for thought and you think about working with the muscles rather than going straight to the bone. I'm Matt Hsu from Upright Health, reminding you that pain sucks, life shouldn't.